she had a revision reverse that I did 2 years ago for instability, and she did well for 2 years. And she said at the 2-year mark that her shoulder was 110% of normal. She had good range of motion. And then at 2 years and 6 days, she was reaching for something and felt a pop at her shoulder. So this is her at 2 years. And again, this is not my primary implant choice. This is a big revision she had for instability. And I thought the components looked reasonable. And then this is her at 2 years and 6 days, where you can see her acromion is broken and there's wide displacement. Now, thing number one that is interesting is if you look back at 2 years, you can actually see a crack propagating through the base of the spine on the lower right image. So keep that in mind, and then look at this one, and you'll see that crack has just kind of completed. So this, for me, taught me a lot about acromial stress fractures. These are just things that occur over long periods of time, in some patients late. So this is what her CT scan looks like. Maybe we'll just switch ahead to the 3D reconstructions that you can see here. So she's got a very medially based fracture. It's really her entire spine that's off, and I think generally these are bad actors. So we decided to proceed with open directional fixation, and these can be very challenging to fix. So I've definitely had challenges with these in the past. So for instance, initially I was using a T-plate over the top because it's a locking plate, but you can see I didn't lock these medial screws, and that screw is starting to creep up, which I don't love. That plate over the top is really a tension band for the acromion, or the pull of the deltoid on the lateral aspect. And then in addition, I've had issues with screws from the top where the plate can break the back of the acromion or the lateral side of the acromion off. So this is my approach with these injuries. I think that you should go lateral decubitus. This means that you don't have the scapula fighting gravity. So